Hey there, this is Dr. Hannah Lane from Wise Chiropractic and Rehabilitation in Spartanburg, South Carolina. Over the past few weeks, I've had quite a few patients come in with temporomandibular joint issues, or TMJ issues. So I thought I'd do a little video to kind of talk about what chiropractic has to offer for TMJ, because a lot of the times people just think chiropractic is used for the spine, when really it's used for every joint in the body. So what people will come to my office with is sometimes it's direct jaw pain. They've had recent dental work done and now their jaw hurts. Sometimes it's popping, clicking. A lot of the times it's headaches. Headaches usually on one side, maybe behind the eye. It can be anything from ringing in the ears to earaches to I've even have trigeminal neuralgia clear up when we started treating the jaw. So the jaw is very dynamic and it moves in a lot of different ways. So some of the ways that it moves, this is my little drawing of the skull. This is the jaw, this is the condyle, and the condyle of your jaw right back here sits up in this mandibular fossa. And in between there, buffering this joint, is a disc, and that's attached to different muscles that help make the jaw move. When you open your mouth, or depression of the jaw, it moves kind of like this. Your jaw kind of moves down and out almost at an angle, okay? So it kind of goes like that in the joint. When that happens, the disc moves, and if it's getting caught anywhere in between there, if it's not moving right or there's inflammation in that area, sometimes we'll hear this popping or clicking or just pain during that motion. Now there are some other key movements that the jaw makes too. Depression, opening, elevation when it comes back up. It also has protrusion, jutting of the jaw, and retraction, bringing that jaw back. That's one of the first things that I check, is the range of motion with patients when they come in and I'm suspecting jaw pain. The next thing that I check is I'll have them just kind of open and close their mouth a few times. What I'm looking for is when they open, does their jaw go straight down evenly? Or does it curve to one side when they do it? And more often than not, if it's jaw pain or jaw dysfunction, that's what I'll see, is it's curving to one side. Sometimes it may even be like a C shape or an S shape while it's moving. But that just shows me that there is some sort of dysfunction within the jaw, quite possibly pointing to the muscles affecting the jaw more than the actual articulation itself. The reason for that is, if it's not even, it's not pulling evenly, there's an imbalance there. So some of the muscles on one side, I've labeled with a T, are tight, okay? And then other ones, opposing muscles, are inhibited. For lack of better terms, that they're lazy. They're not doing their job. They're not pulling their weight, and that's what's causing that deviation and dysfunction. And sometimes that's on the side of pain. More often than not, it's not on that side of pain. But there's a lot that chiropractic has to offer here. First of all, what we'll do is we'll do a massage outside the jaw, working out any trigger points, kinks, or knots in the muscles from outside. I also do a lot of internal work with the jaw, because you can actually reach those muscles that lie so intimately close to the jaw from inside the mouth. So with a gloved hand, I'll go in, I'll do trigger point therapy on those muscles, some distraction and adjustments internally as well as externally, all focusing on opening up that joint there and getting it moving again. These techniques are super powerful and extremely effective for getting jaw movement back, decreasing pain, and just getting you back to where you want to be. The other things that we'll do is we'll do some rehab with our patients, teach them how to do it themselves, and teach them how to even keep it up with just some simple at-home exercises. If you or anyone you know are suffering from jaw pain, give us a call at Wise Chiropractic, 585-5558.